Weight loss surgery has proven itself to be effective and safe for helping people to lose weight and maintain a healthier lifestyle. But how do you know if it's right for you? Welcome to the GW Healthcast. I'm Dr. Mike Smith, and today's topic, weight loss surgery, the basis of winning through losing. My guest is Dr. Hope Jackson. Dr. Jackson is Assistant Professor of Surgery at the George Washington University School of Medicine and Health Sciences and is affiliated with the George Washington University Hospital. Dr. Jackson, welcome to the show.
Thanks so much for having me. Great to be here.
Well, thank you for coming on. I really appreciate it. Obviously there is a continued growing interest in weight loss surgery. As you know, unfortunately, overweight and obesity rates continue to climb in this country. But I thought maybe we could start with a little history about weight loss surgery. Kind of how did it get started? Where were we and where are we today?
Sure, those are great questions, and you're right. I mean, patients who have obesity, we lose about almost 500,000 of lives per year are lost for the complications of obesity, and it's one of the second leading preventable causes of death after smoking. So it's definitely become really a health crisis at this point. Where we were, really, if you look at the history of weight loss surgery over the last, say, 30 years, our understanding has really changed substantially. Really, the primary procedure that was done for weight loss when you look back in the 80s and 90s was really the gastric bypass, which I can talk about a little bit later, and varying iterations of the gastric bypass. And what we do now is we still offer the gastric bypass, but there are a few other options that we offer, namely the gastric sleeve, the sleeve gastrectomy. Those are really the two primary weight loss surgery options that we have now. And really that's evolved based on an understanding of how we lose weight, why we lose weight, and how to use surgery as a tool to maximize the weight that we lose. So really, the two principles are going to be restriction, which is decreasing the amount of food that you can eat, and then malabsorption, meaning changing the amount of food that you eat that you can actually absorb and your body can store as calories. So all of weight loss surgery is based on one or two of those principles, and that's pretty much where we are today in terms of thinking about weight loss surgery.
So when you think about the two main types there that you mentioned, you started with, again in the 80s and the 90s, it was gastric bypass. So tell us about that one, and why was there a need to develop another one? Tell us kind of how that evolved.
Sure. Great. So in terms of the gastric bypass, it really works based on two principles. Again, restriction, meaning changing the size of the stomach. So we are going to make the stomach a lot smaller. It's going to be about the size of the palm of your hand. And then the second principle is going to be malabsorption. So we're going to actually take a piece of your small intestine, connect it to the small stomach, and bypass a portion of your small intestine so that a segment of your small intestine can't absorb nutrients. And so patients lose weight because, one, they can't eat as much because their stomach is smaller. And then two, they're not able to absorb all of the calories that they're eating. So they have kind of potentiated weight loss. What we found, just looking at these patients and looking at them over the course of 10 years, there began to be patients who, for various reasons, whether it was because of their comorbidities, meaning the health problems that they had, their ability to tolerate certain surgeries, we started to do a sleeve gastrectomy, meaning we just cut the size of the stomach. We didn't really change what the body absorbs. And we were finding that patients were also losing a significant amount of weight, almost as much as they're losing for a gastric bypass. So then the sleeve gastrectomy really in the last 7 to 8 years has really exploded as an option for weight loss surgery because we're finding that patients are also able to lose a significant amount of their excess body weight.
So both of these techniques are effective. But I do want to ask you because, and I think some of my audience members might think this as well, when you talk about the gastric bypass approach and you talk about maybe not absorbing as many calories, does that mean they're not absorbing as many nutrients either? Was there an issue there?
Yeah, that's a great question. Yes. So what we were finding is some patients, and there are various versions of the bypass where we found that some patients were losing, not absorbing much in the way of nutrients, and they were having nutritional deficiencies, which can manifest as hair loss, problems with bones, osteoporosis. So we were finding that because patients were having nutritional deficiencies, we were having to make sure that they were on vitamins for life. And so out of that really came a way to try to avoid having some of those nutritional deficiencies. And so there are certainly less nutritional deficiencies with, or less potential for nutritional deficiencies with the sleeve gastrectomy. Both are at risk for nutritional deficiencies, but because we're not really changing, we're not rerounding any intestines with the sleeve, we're finding that there really aren't as many nutritional deficiencies. Really, the major one is vitamin D.
So, Dr. Jackson, in your expert opinion, who should the surgery be for? Like, what type of person should seek this procedure out?
That's a great question. So the main reason that we do this procedure is really because of what we call obesity health-related risks. So patients who have high blood pressure, heart disease, diabetes, obstructive sleep apnea, all those medical conditions are going to increase their risk of having some type of morbid condition or mortality from obesity. So patients who have these health-related risks and patients who have a body mass index, which is a calculation based on your height and weight, that are within a certain range, as well as these health risks, are typically candidates for weight loss surgery. So typically we say if there are any patients who are struggling with their weight, they're finding that diets or medication are not controlling their weight, and they have these medical conditions, that they should talk to their primary care physician about being a candidate for weight loss surgery and then being referred to a weight loss center to kind of review their history and see if they are true candidates for the procedures.
Yeah. I like the way you said that. So it's not just I need to lose the weight, that may be true, but it's also I need to improve the health of my heart. Maybe it's diabetes, whatever. So you're really doing this as a way of helping to maybe prevent some of those, as you said, comorbidities associated with obesity. Can you just maybe walk us through what it's like, maybe what happens before the surgery? I mean, obviously we're not surgeons, so we're not going to understand the surgery part of it so much, but generally, like, what is it like before and really ultimately after, and what kind of outcomes can we expect?
Sure. So before surgery, you'll come to our weight loss center here, and you'll meet with us. It's an entire team that's really focused on meeting your weight loss goals. So you'll meet with us as the surgeons. You'll meet with our nutritionists. You'll meet with our psychiatry team here, and you'll also meet with our team members, our coordinators here, who will help move you through the process. And what we'll do is we'll talk about your goals. We'll examine you, and we'll start you on a nutrition plan. Usually, in order to actually have weight loss surgery, you'll have to complete at least 3 to 6 months of a nutrition dietary plan, where we'll talk with you. You'll work with our nutritionist. We'll help you with your meal planning. We'll help you understand how to make healthy choices, really changing your relationship and understanding of food. So that's a key component, our nutrition program, and that's going to be, again, 3 to 6 months prior to any surgery. Once you've completed that, we'll also work with your primary care physician to make sure you're cleared from a medical standpoint. And then we'll take you to surgery. And depending on whether or not you're doing a bypass or a sleeve gastrectomy, we'll do one of two things. We'll either, for the sleeve gastrectomy, we'll cut your stomach, and about more than half of your stomach will be removed, and you'll have about a third of your stomach left. And again, that's just to provide restriction. So some feedback, you'll feel full after eating small amounts. And if you're getting the bypass surgery, what we'll do is we'll also make your stomach smaller, and then we'll, again, reroute your intestines to change how much nutrients your body can absorb. Following surgery, you'll be in the hospital for 24 to 48 hours, and we'll be working with you, and our physical therapist will be working with you to help get you moving, walking, taking deep breaths. We'll work with you on your new diet plan while you're in the hospital. And then you'll see us afterwards for several visits. You'll see us about 2 weeks after surgery, then 6 weeks after surgery, 3 months, 6 months, 9 months, and then a year. And at each of those visits, you'll be seeing us as well as our nutritionist and dietitian to make sure that you're staying on track with your healthy eating, and we'll be watching you to make sure you're meeting our weight loss goals. In terms of what we expect with your weight loss, we'll calculate some numbers beforehand, and we expect you to lose about 70 to 75% of your excess weight. So if you are 100 pounds overweight, we expect you to lose about 70 to 75 pounds by adhering to our nutrition plan and with the surgery. That's kind of it in like a 2 minute. I don't even know if I made 2 minutes. A nutshell.
Yeah, that's great. No, that was great. It just helps people, I think, sometimes just to hear the process, right?
Sure.
And that there is some thought that goes into it at the beginning, and especially helping people with the dietary advice, better relationship with food. I think that's important up front, and then of course the effective results down the line. I think Dr. Jackson, we should end with. Just kind of your take on this, the whole weight loss surgery process. What would you like people to know about weight loss surgery?
Yeah, great question. I think the most important thing to know is that if you're interested in weight loss surgery, it is a total process. The surgery itself is not going to cause weight loss by itself, right? It's going to be a total effort on our part in terms of doing what we need to do for the surgery, but then also on you to make healthy eating choices and to really change your nutrition plans, which we will help you with before and after surgery. These operations are going to work better with exercise and healthy living. Healthy eating. And they are merely tools to help you with your weight loss and with your healthy eating. They're going to work better when you follow up with us regularly, and they're going to work better when they're combined with increased activity and exercise. That's kind of the key takeaway that I tell all my patients.
Perfect. That was an awesome summary, Dr. Jackson. I want to thank you for the work that you're doing, and also thank you for coming on the show today. You're listening to the GW Healthcast. Please visit gwdocs.com to get connected with Dr. Jackson or another provider, or you can call 1-888-4GW-DOCS to schedule an in-person or virtual appointment. I'm Dr. Mike Smith. Thanks for listening.